Welcome to This Explainer. Today, we're unpacking the absolutely critical steps to safely delaying Medicare when you hit 65 but are still on the job. I know, if you're approaching this huge milestone, you probably have a ton of questions about what you actually need to do versus what you can just put off for later. Okay, let's dive right in. Hitting 65 comes with a massive misconception about your healthcare. The truth is, turning 65 doesn't automatically mean signing up for Medicare Part B if you're still in the workforce. Let's uncover the secrets of making an informed decision to keep more money in your pocket while ensuring you're protected. We're going to build a comprehensive, step-by-step summary of exactly how this whole thing works. To make this dense topic easy to digest, we've broken it down into 6 clear steps. Intro to Medicare Part B, assessing your current coverage, steps to delay enrollment, important rules and considerations, frequently asked questions, and finally, a conclusion with your next steps. All right, Part 1, Intro to Medicare Part B. So, you know how Medicare is divided into different parts, right? Part A covers your hospital stays, and it's often premium-free as long as you've worked and paid taxes long enough. A lot of folks just sign up for Part A the second they turn 65. But Part B? Part B is a whole different ballgame. It covers outpatient services, think your regular doctor visits, tests, preventative care, and because of that, it comes with a standard monthly premium. If you're still working and your employer already provides great health insurance, well, you probably don't want to shell out for a monthly Part B premium when you don't even need it yet. But here's the catch, and it's a big one. If you decide to just skip Part B without following the rules, the financial consequences are severe. Literally, if you get this timing wrong, you face a permanent compounding penalty. For every 12-month period you delay signing up without having what they call proper coverage, your monthly Part B premium shoots up by 10%. And that penalty? It lasts for the rest of your life. No way around it. This is exactly why we need to be absolutely meticulous about how we handle this delay. Let's move on to Part 2, assessing your current coverage. Now, what's really fascinating here is how the size of your current company completely flips your strategy. Imagine Sarah, a corporate executive at a Fortune 500 company, versus Mark, who manages a small 15-person marketing agency. Because Sarah's company has 20 or more employees, her employer's group health plan remains the primary payer. That just means they pay her medical bills first, and Medicare would only be a backup or secondary. So in her case, she can usually safely delay Part B. But for Mark? Working for a small business with under 20 employees flips the script completely. Medicare automatically becomes his primary payer at 65. If he doesn't sign up immediately, his employer plan will only pay secondary, which could leave him completely exposed to crushing out-of-pocket medical bills. So let's say you're like Sarah at a large company. You're safe, right? Well, there's one more hurdle. You absolutely must ensure your current plan is considered creditable coverage. That's essentially government speak, meaning your current health and prescription drug plan is actuarially equivalent to, or in plain English, at least as good as Medicare. Earning this status is basically your golden ticket. It's what lets you safely delay Part B without getting hammered by those lifetime late penalties. You'll want to explicitly ask your HR department or benefits manager to confirm, on the record, that your plan is indeed creditable. Okay, Part 3, steps to delay enrollment. Look, delaying isn't just some mental note you make. It requires a physical, documented action plan for when you're finally ready to retire or leave your job. Step 1 is what we just talked about, verifying that creditable coverage with your employer. Step 2 is super vital. When you eventually apply for Medicare, you're going to need your employer to fill out a specific form, CMS L564, to prove you are actively covered. And step 3 is submitting that proof, right alongside your actual Medicare Part B application, which is form CMS 40B, straight to the Social Security Administration. You can knock this out online, by mail, or just go in person. And here it is, the actual paperwork you'll need, form CMS-L564. You fill out Section A, but Section B is the part your boss or health plan manager has to sign. It literally asks them to verify the exact dates your active coverage started and ended. This single piece of paper is your proof to the government that you've had active, creditable coverage ever since turning 65. It's the shield that protects you from those awful late enrollment penalties. Moving right along to Part 4, important rules and considerations. As we navigate a bit deeper, we need to spotlight some hidden traps that frequently catch working seniors off guard. The most critical timeline you have to understand is your Special Enrollment Period, or SEP. The exact moment you stop working or your job-based coverage ends, whichever of those happens first, a strict 8-month window begins. The clock is ticking. You have exactly 8 months to enroll in Part B penalty-free. If you miss this window, oh boy, you're forced to wait for the general enrollment period between January and March, and your coverage might not even start for months after that. We're talking about a massive, terrifying gap in care where you are paying totally out of pocket. Then there's what I like to call the HSA trap. If you have a health savings account, listen very closely to this part. Once you enroll in any part of Medicare, even the free Part A, you can no longer contribute to an HSA. But here's the real-life scenario that trips people up. Let's say you plan to retire and enroll in Medicare on July 1st. Well, when you enroll after 65, Part A coverage can actually be applied retroactively for up to 6 months, meaning the government might consider you enrolled starting January 1st. So if you contributed to your HSA between January and July, the IRS views those as excess contributions, and they will absolutely hit you with excise tax penalties. To be safe, you must halt all HSA contributions a full 6 months before you plan to start Medicare. All right, Part 5, Frequently Asked Questions. Let's tackle some of the most common questions that trip up even the savviest folks. Question number 1. Does COBRA count as creditable coverage for Medicare? You know, when you leave a job, it feels incredibly safe and easy to just stay on the plan you already know by paying for COBRA. But is COBRA actually going to protect you from those Medicare late fees and keep your 8-month window open? The answer is a definitive, resounding no. This is a massive, massive trap. Medicare does not consider COBRA to be active job coverage. Your 8-month special enrollment period clock starts the very day you stop working or your active group plan ends, completely regardless of how long your COBRA lasts. If you ride out, say, 18 months of COBRA before applying for Medicare, you will have missed your 8-month window entirely. And yep, you'll be slapped with lifelong late enrollment penalties. Okay, question 2. What happens to my Medicare status if I start claiming Social Security while I'm still working? A lot of people try to coordinate their retirement income while they're finishing up their final years in the workforce, which brings us to another hidden trigger. Let's see how this builds on that HSA trap we discussed earlier. Claiming Social Security benefits automatically triggers your enrollment into Medicare Part A. You don't even fill out a separate form. It just happens behind the scenes. And remember that HSA rule? If you're automatically enrolled in Part A because you started taking Social Security, you immediately lose your ability to legally contribute to your HSA, even if you're still working full-time with a high-deductible health plan through your employer. Finally, Part 6, Conclusion and Next Steps. We've covered a ton of ground, so let's summarize the decision matrix. When you compare your options, there are clear trade-offs. With your employer insurance, the costs are shared with your company, but the coverage is entirely tied to your job. Medicare, on the other hand, means you pay the Part B fee and potentially a Part D drug plan fee, but that coverage is totally portable. It stays with you for life anywhere you go in retirement. So your next steps, head over to Medicare.gov to learn more. Definitely check with your HR department about your specific company size and plan credibility, and seriously consider speaking with an independent Medicare broker who can hold your hand through these specific forms and timelines. Which leads me to this final provocative thought. Are you making your healthcare decisions based on assumptions or based on the actual rules? Because a single assumption here can literally cost you a 10% penalty on your premiums for the rest of your life. Take control, ask the right questions, and remember, this content is intended for informational purposes only and does not constitute legal or financial advice. Please consult with a qualified professional to discuss your individual circumstances. Thanks so much for joining this explainer, and we'll see you on the next one.